Hello and welcome to Wellness Wednesday. I'm James Currie with the Communications Department, and I'm talking to Cortney Yohn. She is the lead prevention program coordinator. Sorry, that's a lot to say there. Um, Courtney, the lead program that we have here at the health department, it's very important in a bunch of different ways. So can you kind of give me a little bit of overview on your outreach and what you do with the program?
Sure. So, my job is prevention, outreach, education. I actually visit different pediatric clinics and family health clinics in the county, educating the providers on the testing that has to be done for children ages 1 and 2. Medicaid requires it. I'm just ensuring that every child is tested, whether they have Medicaid or private insurance, just to make sure that our kids are safe. We have social workers at this agency that will also work with families that have children with elevated blood lead levels and try to figure out the source and how to, you know, fix it and keep the kids safe and healthy.
Now, one of the reasons why you're on Wellness Wednesday with us this week is we're observing lead prevention awareness week, and
Right.
that's a very important week for us. You said that you do several different outreaches at different health center locations that we have, but it also just brings awareness to this issue. Um, Now, I know there's certain criteria that a household has to meet to be considered a dangerous or you know an environment to be concerned about. So can you tell me a little bit about some of that criteria?
Yeah, some of the red flags that we look at are houses that are built prior to 1978. A lot of the houses that were built in the 70s use lead based paints. The paint starts to chip. Children will peel it, they'll put everything in their mouth. It's actually a sweet taste, so that can be poisonous to children. Not only that, but say the parents work in a factory or somewhere where they're exposed to lead, and just the dust on their clothes they can bring back into the home. Wearing their shoes, their clothes into the house can leave dust particles on the floor. Children are crawling. It can get on their toys. Children put, like I said, everything in their mouth. So we try to educate the parents as well. I'll actually be setting up at all of the Mobile County Health Department clinics in the county this week and just educating parents and patients too on the dangers of lead in the home and what they can look for.
Um, yeah, I think you touched on some of those um, topics there about things to look out for, especially if the home was built before 1978.
Mm-hmm.
Um, so there are, if a child is exposed to lead, um, can you kind of talk a little bit about some of the effects that that has on the child?
Yeah, it can have neurological effects. It can cause the child to have developmental delays or behavior problems. ADHD has been linked to lead poisoning, and a lot of children exhibit these behaviors. And if they would have been caught early, if the lead poison had been caught early, we could have tried to help rectify that and reduce the lead levels to hopefully reduce the damage that it's done to the child.
Now you talked about detecting or catching it early. So
Mhm.
um, how would somebody do that?
So children go to their well visits, hopefully, and they get shots, immunizations. They also have blood work done, and they're tested at ages 1 and 2. If they have an elevated level, they have to do more extensive blood work to just ensure that it is an elevated level. And then a report is sent to ADPH, who then sends it to the health department, and our social workers will go out and visit the homes and see if we can find the source of the lead poisoning. Children have to be retested every 3 months to see what the lead levels are doing. We work with the family until the lead levels have decreased.
It sounds very thorough when you have
Mhm.
determined that there's a risk in the household. Um, So, you talked about some of the things to look out for, and then you talked about the effects on the child.
Hmm.
Um, so tell me how there has to be some steps to protect the child, right?
Right. Keeping a clean house, sweeping, dusting, mopping. Those things are all important. If there is lead in the soil outside your home and you have the windows open on a nice fall day, that dust can enter your home that way. Um, it's possible that you could have lead in the pipes of your home. So, run in the water for a minute before you fix a drink of water or a bottle or anything like that, just to let the water flush through the pipes. And just being aware, being educated is probably the first step so you know what to look for in your child as well as in your home.
Sorry about the phone there. You never know with these Zoom meetings what's going to happen. Luckily, nobody will walk in, when I'm recording. But um, so I think that I think that going over those steps that a parent or a caregiver can take, that seems like you know there are a lot of ways that is possibly preventable or able to keep it under control. Um, so, anything else you want to add about the lead prevention program?
Yeah, just that we do also work closely with WIC, and we want to encourage families to feed their children healthy diets rich in calcium and iron that helps absorb any lead that may enter the body. Also, something that here, by the bay, what we look at is fishing and the lead weights on fishing line. That is pure lead. That is poison. Hunters, your ammunition, your lead bullets, that is lead, that's poison to a child too. So just be mindful of those things around your home as well. And education is the best prevention.
Well, that's pretty good. I didn't think about those two things. If someone in the household is an outdoorsman,
Right.
those things too. Yeah, that I guess getting gasoline that has lead in it, and so we're always exposed to it. So we really have to be mindful of it. Um, so if anybody wants some more information from you, or how they can just find out some more about the lead prevention program, can you give your contact number?
Sure. My number is 251-544-2080. And there are social workers throughout the agency at the different clinic sites that are also working very closely with families that have children with elevated lead levels. They're very knowledgeable in lead poisoning, and they can be reached at any of the clinics at any time.
Well, thank you for being on Wellness Wednesday, especially this week since it is Lead Prevention Awareness Week. And I think you were very thorough, and I appreciate you going over all these points here for people to know that they just may not realize.
Thank you.
Well, thanks a lot. And thank you again for being on Wellness Wednesday. And everyone out there that follows us, just keep tuning in on Wednesdays for a different topic on health. Thank you.